Hi everyone, my name is Laura Wisse and today I'll be giving a demo on the segmentation of the whole hippocampus on T1-weighted MRI. If you haven't done so already, I recommend first watching my tutorials on whole hippocampal anatomy and hippocampal subfield anatomy. And I do want to point out as well before I get started that there are actually quite a large number of different segmentation protocols which all differ in certain locations. So I'm just going to show you one segmentation protocol, but I'll try to point out the locations where there are differences between protocols. So if you look at the image, you can see that this is a T1-weighted image, a coronal slice of the whole brain. And in a T1-weighted image, the gray matter is looking grayish and the white matter is looking more white, brighter, and then the cerebral spinal fluid, CSF, is looking dark. I'm gonna zoom in to the right hemisphere, and it's probably hard to see, but I think this region here is the hippocampus and this is the amygdala, but you can also see that it's pretty hard to differentiate. So I wouldn't recommend starting segmentation in the anterior tip of the hippocampus, but I generally go to a place where I can see the borders a little bit better. For example, this slice. So here the hippocampus is surrounded here by the white matter, some CSF, white matter here, CSF, all the way there. And here this uncal region or vertical digitation is actually separated from the gray matter by these darker voxels, and they're not quite as dark as some of these voxels, which is probably because of partial voluming, but this is CSF. So I'm gonna outline the border with the lighter appearing right matter, go to the most medial points. I'm going to include this portion, and there we go. Okay. So I'm wondering about this. It sticks out a little bit, and if I go in another direction, I can see that it separates. So I think that's actually a vessel, so I'm not going to include that. So I'm gonna go in a anterior direction now, and I see kind of this dent and then this dent, so I think that would be the border with the amygdala. So see here the border with the white matter, the border with the CSF, then taking that border that I just pointed out, some darker voxels here, and to the most medial point here, and then the border with the white matter again. I'm gonna remove some voxels here which look a little darker and some lighter voxels here. I'm gonna go to an anterior slice. So again, I see some darker voxels here and there, so that would be my border. Okay. And I start always in the coronal plane, but I'll actually go to the sagittal and the axial plane as well to improve the segmentation in the end. So we're going further, and I think the border is now around this location. I see some darker voxels here, so actually an easier way is to outline the amygdala, which you can see here. And I think that's the amygdala, so that would also be my border with the hippocampus. So I'll show it also on some other slices. Okay. I think again this is a vessel. It's sticking out a little bit weirdly, so I don't think that's part of the hippocampus. And I think that's correct. I don't think that is. Okay, so one slice anterior, and again, if I'm following the amygdala, I see some darker voxels here and here. So I think this would be the outline of the amygdala, so that means that that was probably the border with the hippocampus. So the border with the CSF here, sorry, the white matter, and then I see some darker voxels here, the border with the CSF. And I'm including this portion. Again, I think probably this is a vessel, this is not hippocampus. Going to more or less the most medial point, and then the border with this white matter. So I do want to point out that this portion is not always included in the hippocampal label. I think it is because it contains transitional regions with the amygdala, but just for consistency, I'm including it now. And I think this more medial portion of this inferior part of the hippocampus is also not always included. So there are differences between segmentation protocols on these points. So going further, it's becoming a little bit harder. What I do see is this white matter border, and I see CSF here, white matter border, and I see some darker voxels here. So I'm gonna go in this direction and go to the most medial point. I see a little bit of an indent here, and I see some brighter voxels there. And I think those brighter voxels are probably the alveus, which is an outer layer of white matter of the hippocampus. So I think that is gonna be my border with the amygdala, which looks a little bit darker there. And then this is a good indication of the border. So this actually, the border with the amygdala is a bit hard, and it's actually helpful to look at that in the sagittal plane as well. So I'm gonna remove some of these darker voxels that I see here. Maybe I'll leave that one. Okay. So I'm gonna go in an anterior direction. So again, I see the white matter border here, and I see this darker voxels here, these darker voxels there, and I see some more of a brighter region here. So I think that's the amygdala, that's the hippocampus. Okay. A little over segmented on this end. So what happens now is I see the white matter border here, the CSF border, some darker voxels here. I see the bright voxels here, which are in contrast with these darker amygdala voxels, and I also see some bright voxels there. So I think the hippocampus doesn't go all the way to the end of the cortex here. I think this is entorhinal cortex, and the hippocampus is in the middle of the MTL now. So that would be my border. I see these brighter voxels, which I take as the hippocampus, and going in an anterior direction, again, white matter, darker voxels, and these brighter voxels here. Okay. Okay, so again, brighter voxels, CSF, and I see this brighter band, so I would draw that, and the hippocampus is becoming smaller in an anterior direction. And then even further, I see the border with the CSF there, white matter. And I'm including, I see some brighter voxels here, so I'm including that. But again, I'll check this segmentation in the sagittal plane. And I'm not so sure actually about this slice, so I'm gonna leave that for now. So going to my starting slice again, which was this one. So now I'm going in a posterior direction. You see some brighter voxels here, and the CSF surrounding it. So I'm going to the most medial point here, and then I think that is it. And then you see the uncus becoming smaller. Okay. I think this is a pretty hard border because of the partial voluming between the gray and the white matter, which makes it a little bit complicated. Okay. And again, this portion starts to become separated from this region. And something to point out here is these darker voxels in the middle of the hippocampus, which is I probably is probably a hippocampal sulcal cavity. So I'm just gonna include it whole. I'm not gonna give that a separate label. Okay. And I think this is becoming a very tiny region. So this is probably the most posterior slice of the hippocampal head. And then, if I'm correct, the next slice is going to be the hippocampal body. Yes, so if you remember this area, in the next slice it's gone, so this would be the hippocampal body. So personally, I draw this border here up to the most medial point of the cortex. So if you outline the cortex, that's around here. So I use that border, but that's a border that's different between protocols. And then I'm including this portion here, which is actually the fimbria. And I'm also, of course, have been including the alveus. And those are things that I would personally do on T1-weighted MRI, but not necessarily on T2-weighted MRI. Okay. And then the next slice. So again, this is probably a little cyst. So we do want to include all of that. Then go to the most medial point and finish that. I actually used this most medial point also in the more anterior slices, but it was a little bit easier to explain where that point is on these kind of slices. Okay. And I think some of these darker voxels are probably partially CSF. And then I segmented a number of the body slices already. Going in a posterior direction now. Up to about this point. So here we're getting more in the anterior or posterior direction, maybe already starting to be in the hippocampal tail. So again, you can see the white matter border, the CSF border on all the other ends, and I go to the most medial point here. And I outline the hippocampus. And it's generally, the hippocampus is easier to see in these middle and posterior slices as compared to the hippocampal head slices. Okay. What you're starting to see here is a white matter band, which is called the Fornix, and I would include just the portion of the Fornix that is adjacent to the gray matter, just like that. But I think, again, this might be a place where other protocols might be different. So again, and one thing that you can also see here is that the hippocampus is starting to have a bit of a different shape, which is also pretty common in the posterior portion of the hippocampus. So and then so here, and then I think I only see this line here. I think that's it. So now I'm gonna go through my segmentation and see if there are things where I can improve it a little bit. I won't take too much time because I think it's more important to start looking in the sagittal plane, but I just want to touch it up a little bit. And I generally just look for voxels, either gray voxels surrounding the segmentation, or voxels that are included in the segmentation but look a little lighter or a little darker than the other voxels. Okay, going through it a bit quickly now. And actually with the S, the letter S, you can turn on and off this segmentation with ITK Snap, which is pretty useful for scrolling through it, as you can see. I'm actually doing this pretty quickly now. Okay. Okay, some more darker voxels here. Okay, so I'm gonna now go to the sagittal plane. So normally when I do editing in another plane, I would leave the coronal plane open, but because of the size of the windows, I'm not gonna do that now. But generally it's helpful to see the other plane so you're not accidentally excluding voxels in a sagittal plane, for example, which actually should be part of the hippocampus, as you can see in the coronal plane. So you can't always tell in another plane if it's part of the hippocampus or not. So I'm gonna try to make this outline a little bit smoother and also check if this area that I see is actually hippocampus or if it looks like, for example, here some incorrect voxels are included. So maybe this one, I think this is actually the outline and there's some partial volume voxels with the CSF here. So, and again, I'm turning on and off this segmentation to tell better what I should be doing. Okay, and we're getting to the border with the amygdala, which is actually this region. And I'm being guided by these lighter voxels. So I think that's the border with the amygdala. So I think I can actually include maybe a few more voxels here. And here as well. So again, that would be this border. So some brighter voxels here, and then the rest of is the amygdala. Okay. I think this slice is even better. You can see the outline of the hippocampus like this, and the rest is the amygdala. So it's really guided by those bright lines there. And these are probably too much. So again, this would be the outline here. I'm actually not drawing that correctly. This would be the outline. Okay. And I think this may be over segmented, so I would remove that. And I think some of these are also over segmented, so I think these are the brighter voxels. So I would probably exclude those and then make it a little bit more smooth. I think the same holds here. I think the border is here, so I would exclude some of these voxels here. Again, this is probably over-segmented. Some darker voxels here. Okay, so now I'm gonna go to the axial plane. So it's a bit inconsistent here. So again, normally I would do this while looking at the coronal plane, so I'm not accidentally removing voxels that are hippocampus or adding voxels that are not hippocampus. Just because you can't see it now, I'm gonna do it a little bit quicker and just looking at one plane at a time. Okay. I'm just looking in this plane because I have a hard time telling the hippocampus in this plane, so I'm mainly looking for some brighter voxels or some darker voxels that are included and shouldn't be, or vice versa. Okay. And then I'm gonna look again in the coronal plane, and I'm gonna start anteriorly. Okay, I'm just again checking if the outline looks more or less okay. You can see now I'm removing voxels again that I just added, so that's why you want to look in 2 or 3 planes at the same time. Okay. It's looking pretty good. And we're almost at the end. Okay. So normally now I would go back to the sagittal, then to the axial, and so on until I'm having a smooth, correct segmentation. But just for now, I'm gonna stick with this one, and I just want to end with showing you the 3D outline, which I think really matches what we're looking for with the thinner tail here, and the broader hippocampal head area here. So I hope this was helpful, and thank you for listening.